Thank you.
So they're doing point.
Checking for proprioception right now. Good.
No, that's in.
So today we're looking at a dog who previously had an MRI performed with us that had a diagnosed brain mass, underwent radiation therapy and decided to recheck several months later what the size of the mass looks like after radiation therapy. So what we're looking at here, the top-down approach, we can see this well-defined kind of round structure here within the brain tissue. This bottom one is the previous MRI, and this top one is the MRI from today. So we're going to do some measurements and compare, and then make recommendations based on that. Just coming in for the 2-week kind of incision or suture recheck. Incision looks to be healing really nicely, so we'll take out these sutures today and continue the healing process, and then we'll see him back in 2 weeks for his 1-month post-op recovery exam.
Hi, bud. Hi.
All right, so incision looks good, honestly. So everything's healing well, sutures are taken out. So basically right now, continue doing what you're doing, continue another 2 weeks of rest, and then we'll see you guys back in a couple of weeks for his 1-month post-operative recheck, and that's gonna be like an official recheck exam. We'll take a look at him, recheck his exam fully, and go from there. All right, but he looks good today. He looks good. He's walking pretty well, so hopefully he'll continue to improve, and I expect it to go that way.
Thank you so much.
You're welcome. It was nice seeing you. Yeah, sure.
All right, buddy.
Extreme pollen.
Hey, bud. Oh, yeah. Black.
All right, so that was our little Schnauzer friend named Ditto. He came in for not being able to walk, so non-ambulatory tetraparesis. So he was able to move his legs, but not able to quite get up and do the things that he should be able to do. So where he localized his issue was his neck, so most likely a disc herniation based on the symptoms and the history. Can't rule out other things, but for right now, talk to the owners about doing an MRI, surgery, things like that if needed, versus medical management. Owners preferred to try the medical management route first since he's improving, so we'll go from there and see how he does. And we'll see him at the end of the month, and hopefully he continues to improve. And if not, we'll see him sooner. We'll get him in for an MRI and surgery if that's where the owners want to go. Hey, bud. First of all, nice to meet you. Second, when it comes to the issues that we're seeing with Hanna, right? So we've started to have these episodes that never had them before, right? What I'm seeing with the exam is what we do with the limbs is check for something called proprioception. And what that is basically their awareness of where their paws are. So when we flip over the paw into a knuckled position, they should be able to flip it back immediately and notice, hey, my paw's in a weird position. They should feel that. Same thing with us. If we closed our eyes and someone flipped over our foot into a weird position, we would know immediately, hey, my foot's obviously flipped over. We can feel that. When there's a problem in the brain or the spinal cord, that can be affected. So when we flip over Hanna's paws, we don't get much of a response in terms of flipping them back over on the left side. The left side's worse. So basically when we flip those paws over, she just keeps them there. The other thing would be in terms of cranial nerves, which is everything up here. So vision, response to facial sensation, facial movement, that kind of thing. The only abnormality that we're seeing there is the left eye doesn't quite respond as well as the right eye when it comes to visual stimuli. My concern with her being her age would be something like cancers. I can't say for sure there's not cancer in the brain causing seizures. Other less likely things would be things like recurrent strokes. Most of the time those strokes cause vestibular disease or like dizziness rather than true seizures, but it's not impossible. So right now, cancer or strokes would be at the top of my list. It's not impossible for an older dog to start having seizures and just have epilepsy, basically, and not have anything in the brain that's really causing it, just a wiring issue, so to speak. But that's less likely. We hope that that's it, and then we can just focus on seizure medications and go from there. But we don't really know without looking.
So if we do the MRI, we'll know what we're dealing with then, and then know how to proceed?
Correct. The MRI will give us some indication potentially as to what's going on. So, all right, so I'll get that sheet for you. We'll get that signed, get everything going, and hopefully we can get you some answers today, okay? All right, so we have Hanna here, our 11-year-old mixed breed dog that was showing signs of kind of a left-sided neurologic deficit in the left back leg, left front leg, as well as a decreased menace response in that left eye. So everything seemed very left-sided, which would indicate to us that something would potentially be on the right side of the forebrain with the history of seizures. So what we're looking at in the MRI, what we found is within the brain. So what we see here in the right lower quadrant of the brain, the forebrain specifically, is this round mass-like structure here. So we can't really tell with 100% certainty right now if this is something like a large stroke or if this is something like a cancerous mass. So right now we're leaning towards stroke based on the appearance. And those generally take time to resolve, so we may send home with some medications, might recommend something like a spinal tap to see if we can get some more information. You know, whether or not we get information is kind of up in the air, especially with these guys with cancer versus stroke. Sometimes we don't get our answers with a spinal tap. But we'll offer that to the owner, see what they want to do, and we'll go from there. Sit.